say some words on Tom Hoogland, who I think most of us remember well. I know I first met him in about 1986 or something, when the boss was Henk Verbiest, number 2 was Peter van Akkerbeek, and the boy right at the bottom was Tom Hoogland. So that's a very long time ago, when he was a young man. Thank you for talking about him.
Okay, first, thank you very much for your introduction. First, Dr. Loy, thank you very much for your nice invitation. It is not only a pleasure, it's also an honor for me to give a talk for Thomas Hoogland. Although I prepared my talk yesterday evening, even if I know it for a long time, but I was always thinking, what should I talk about him? Because for me, you may believe or not, he is still present. Something very important for me, I would like to welcome his kids. At least he had 3 kids. Petra Hoogland, she's there, over there. And here in front, Jaap Hoogland. And it's great that you are here. Let me give you an overview. Who was this guy, Thomas Hoogland? I think some of you, I know already for 10 years, they know him. Maybe some of you, the younger ones, they don't know him. Later on I will tell that he was, for me, a brilliant, not only a brilliant person and surgeon, he was a genius in that things, from my point of view, what he did. He was born in Netherlands in May 1945, and he went to medical school at the University of Groningen in the Netherlands, and he made his medical degree in the Netherlands. After he made this American board examination, and for 5 years, from 1973 to 78, he was trained mainly by Dr. Steffi, who was for him very an important trainer and person and surgeon at the Cleveland clinic in Ohio, United States. He certified his board as orthopedic surgeon in the United States. And after that, he came back to the Netherlands as an associate professor at the orthopedic department at the University of Groningen. And then he made his doctor degree, his PhD. And later on, from 1980 to 1989, he was a consultant orthopedic surgeon in a private practice at the Ignatius Hospital in Breda. But I think it was not enough for him. There was another guy in Germany, in Munich. His name was Jürgen Toft. He was also an orthopedic surgeon, but not a spine surgeon. He was a knee surgeon, and he was looking for someone like Tom, with visions, with new ways of thinking. And so he decided to move from Netherlands to Munich, and he came to the Alpha Clinic. During that time, during his lifetime, he performed more than 14,000 spine operations. He performed more than 10,000 of minimal invasive spine surgeries. I think what I remember, when I came as a fellow to him in 2002, he told me that he did already 8,000 endoscopic procedures, and we both together, we did more than 4,000 in 6 years. Maybe some people of you don't believe it, but we performed almost 1,000 endoscopic procedures a year. Number of scientific publications, he was not lazy for that, 26. Number of organized meetings, also he was the president of an IITS meeting in 2004. The total number, for example, just to give you some numbers, are 9 book contributions, 5. Tom. His vision was an own specialized clinic, and his motto was leading through specification. How did I met Thomas Hoogland? This story, I have to tell you, was a little bit crazy, because I personally was trained in the end of 80s and beginning of 90s. It's the most German famous spine center and scoliotic center, Bad Wildungen, Metz Stavenhagen. Maybe some of you guys knows Metz Stavenhagen. He is still very famous for scoliotic treatment. And one day, every morning we had a meeting. One day, the time is passing very fast. I have to, sorry, I think I need a little bit more. He came and he said, you guys, yesterday I got a crazy story. There is a guy, a Dutch guy in South Germany, it's Munich, and he's performing spinal surgeries through keyhole. It doesn't work. Yesterday I had a patient and it failed, it was not good. This is bullshit what these guys are doing. It doesn't work. You believe we make cuts like incredible, sorry, now I'm using here my presentation. And so I thought, Metz Stavenhagen, very famous, this guy must be right. And because during that time, I was used to cuts in the back, like you see here. This was, for me, during that time, the golden standard. If you have back problem, not only for correction of a deformity, big cuts. Big surgeon, big cuts. From my point of view, and after many years, I was already an orthopedic surgeon and I was looking for something new, what is maybe challenging me. And there was a guy in Munich and he said, what are you doing, Michael? And I said, I don't know, maybe I'm moving to another city here, I'm not satisfied. And he said, I'm here in Munich. And I said, where in Munich? What are you doing in Munich? Yes, that's the Alpha Clinic with Thomas Hoogland. And I said, Thomas Hoogland, come on, what are you doing there? He said to me, it's incredible what this guy is doing. I said, wow, maybe I have to see it. Maybe Metz Stavenhagen was not right. Maybe he was wrong. And we arranged an appointment and we made a deal that I would like, because he was looking for, let me say, a surgeon like me who did everything. Open thoracospheral lumbotomies, big surgeries, fusions, artificial disc replacement, all these things I learned in Bad Wildungen. And he was looking for a guy like me. And I said, okay, I want to see this keyhole surgery. And I went there and he made the first endoscopic disc removal. And I thought, I don't believe. No general anesthesia, no loss of bleeding or of blood. And 2 hours later, the patient was already walking. Not like I was used to it. Staying in bed for 2-3 days, a cut minimum like that, I couldn't believe. Next day, he performed in the neck a percutaneous procedure, also a removal of disc herniation. I couldn't believe. For me, it was a miracle. Now, after 1 week, he asked me, Michael, are you interested? What do you think about it? I said, it's amazing. And so I started to work with him. So I think Tom was the trailblazer and mainly for changing the endoscopic golden standard later on for lumbar spine surgery. Instead of the old-fashioned technique, I had and Tom had a lot of fights, not only with Martin Knight or Tony Young. We always had very controversial, but I think at least very interesting discussions. And what is the outside-in technique? Tom's philosophy was the outside-in technique, not to go first into the disc and then into the spinal channel. No, he wanted always to see first the pathology in the spinal channel. 1990, he develops his own special instruments, reamers, for the transfemoral approach. 1992, he developed his own instruments for the approach for a percutaneous procedure in cervical spine. 1998, development of special endoscopes for the spine. 2001, if I remember the right date, he started the cooperation with the Joymax company. 2006, different philosophies terminated the cooperation with Joymax immediately. It was hard for Tom he didn't know what to do now. He lost all his patents and rights on mainly his idea. But Tom was a sportsman. He was rowing when he was young. In that time, I was an Ironman, even if you don't see it right now, because my belly is getting bigger and bigger. But we both had something similar, and that was never give up. The consequent evolution in endoscopic spinal surgery was almost developed. He developed in 2006 new instruments, not anymore reamers, bores with a direct approach. 2008, he started his foundation and marketing of the Maxmore, and it wasn't the JoyMax, it was later on the Maxmore system. He proved that any disc herniation can be removed successfully endoscopically at all locations in spine, in cervical spine, in thoracic spine, and lumbar spine, independent of size, of location, or of the anatomy. So, the passing of Tom is a source of deep grief, not only to me, but a loss to all of us. To his patients, to his family, and to his colleagues, to his employees, and to his friends. Tom was not only a brilliant physician, who was always there for his patient and who did all what was in his power to help them. He was also a mentor and trailblazer. He was always looking for still more efficient and more tissue-sparing therapy methods and spent great effort in developing his new and groundbreaking surgical approaches. His behavior was toward us shaped by respect. He was always modest and had a smile for every one of us who worked with him, and he was on the wheel and woe of its employees' interest. We are all aware of what we owe you. Everyone had the opportunity to develop and to put his talents to the task, it or him put to the test. Not only me personally, but all of us are incredibly proud to have worked with you, Tom. You had great ideas, had implemented these powerful ideas. What is not easy, as you all maybe know. One must particularly mention your generosity. We were always grateful for it, and some doctors from all over the world still, and also personally me, benefits from you. You've not only changed the world of endoscopic spine surgery, you have also changed the philosophy of how we can treat our patient on a smooth and gentle way. With admiration, with admiration and respect, we look back on what you have built and delivered. Sadly, you left us too early. Thank you.